Hello and welcome to Ontario Without Barriers, a channel where we discuss different resources for adults with disabilities. Because having a disability is hard enough, finding resources shouldn't have to be. In this video, we will discuss free private home care options that require no money and no insurance. First, let's give a definition of what home care is. The Ministry of Health defines home and community care as services for people of all ages who require care in their homes, at school, or in their community. These can be seniors and people with complex medical conditions of all ages, including individuals with chronic care conditions, persons who require palliative care, individuals who require post-acute care at home, persons with disabilities who require care over a longer period. Why home care? Home care is important because it provides individuals with personalized care in the comfort of their own homes, enhancing their quality of life and well-being. It also supports independence and can reduce the need for hospital stays and long-term care. Research has shown that people prefer to stay at home as long as possible. Ipsos found that nearly all Canadians 45 and older want to age at home, but only 1 in 10 say they can afford the cost of a personal support worker. Not only do many Canadians prefer to stay at home, but home care is the most cost-efficient form of care. As this graph shows, it costs the taxpayers an average of $730 per day to care for patients in the hospital. It costs $210 per day to care for a patient in a nursing home, but it only costs $90 a day to care for a patient in their own homes. So you may be thinking, if people want to stay at home and home care is the most cost-efficient option, then what is the problem? The problem is that the vast majority of home care in Ontario is delivered through for-profit corporations. This creates a lack of consistent and proper care as well as high staff turnover. This leads to a burden for patients and their families who rely on home care services. CBC Marketplace recently did an episode about the challenges many people face when dealing with home care agencies. I highly recommend watching the full episode, which is linked in the description. One part of the program that stood out to me the most was that of the no-shows, which you will see.
Listen to this. One reason some visits might get missed, ParaMed schedules him to see two different people at the same time.
How often do you get a double booking on your schedule?
Probably once a week at least. I'll look at my schedule and it'll be overlapped or double booked.
Well, why would the company do that?
They can make double what they make in an hour sometimes, and they're shorting the client.
Clients actually give up on calling in to complain because it's become normalized in home care.
Do you think the company is still billing for that visit?
Yes, yeah. The ways in which it happens can be people don't complain and therefore it's not marked. The companies purposefully or not purposefully don't track very well and they get paid anyway.
Even though nobody showed up?
No care delivered, but the money still flows.
So just how many visits do home care companies miss and still get paid for? We try to find out.
This Auditor General's report says home care companies do not have to report how often they miss visits.
How do they know how often that happens then?
Well, good question if no one's tracking it.
It also says the government doesn't involve itself in resolving any of these complaints.
Now, you tried to find out about that, right?
Well, they said it could take months to get this data, but they also said if we wanted to know about the companies involved in the complaints, that they'd have to get the company's permission.
The company's permission, even though it's public dollars? Wow.
As you can see, since for-profit care agencies don't have to report no-shows, there are no consequences if they do not provide the care. There is also no government agencies to resolve disputes, meaning they will not deal with the complaints. What was not discussed in the program, but I know through experience, is that many for-profit care agencies bid for contracts to provide care to certain groups. For example, if you need palliative care or if you have a child with a disability, your agency has been chosen for you without your consent and knowledge. If you want to switch agencies, you can't, because the agency that has a contract for your care based on factors outside of your control. This is why Ipsos surveys show that many people are worried about having to pay for PSW care out of their own pocket, because of the negative impact of these agencies. But what many people don't know is that there are currently 2 programs in Ontario that provide home care for free. These programs provide you the funding in order to hire and manage your own staff and care your way. The first we're going to talk about is Direct Funding's Attendant Services Program. Attendant Services means getting care from a trained person with everyday tasks. People with disabilities are in charge of deciding what they need and training their staff. Attendant Services includes bathing, personal grooming, dressing and undressing, toileting, transferring and positioning, meal preparation, and light housekeeping. Home and Community Care Support Services Family Managed Home Care Program. The Family Managed Home Care Program provides funding to eligible patients or their substitute decision makers for purchasing home care services or hiring their own staff. Family Managed Home Care recipients can select their own providers, determine how and when the care plan is delivered, and handle all the administrative tasks, including managing providers, funding, and reporting documents. Both programs are generally equal, but there are certain notable differences that might make a certain program more suitable to you. Pros for direct funding. One of the pros for direct funding is that it is available anywhere in Ontario, as opposed to family managed care, which is managed through your local home and community support services. Further, if you are going to school outside of Ontario, you are still eligible as long as you are a permanent resident in Ontario. The program also has a Student Attendance Service Fund, which is a special fund that helps students in Ontario who have been assessed for attendance services but aren't currently receiving them. For more information about direct funding program, including how to apply, a link is in the description. Pros for family managed home care. One of the pros for family managed home care is that caregivers can manage the program as a substitute decision maker. You can also use an agency, but the choice of the agency is up to you. And if you don't like the agency, you can leave. This would be a great option for individuals who want less managerial work, but still requires administrative work. You can also use PSW care as well as nursing care under this program. For more information about family managed home care, including how to apply, a link is in the description. With any programs, there are things to take into consideration. The realities of managing your own care. General costs. You are a manager and have to take on all the responsibilities. You have to manage your care as if it was a business. Essentially, there's a lot of administrative work, putting out applications, hiring, training, scheduling, and firing. Finding a bookkeeper and managing payroll, having a CRA business account, a WSIB account, having a large liability insurance because you're managing your staff, and sometimes there's even a wait list for these programs, so it's best to apply as soon as possible. The general advantages to managing your own care is enormous. First of all, you don't have to deal with a corporation that doesn't care about your needs. When I had agency care, I would call them every single day to see if I would get coverage because it was never consistent and you wouldn't know if whether or not someone's going to show up to your door until nobody shows up to your door. And all they would give you is countless excuses about why the staff didn't come, when in reality, they were never scheduled in the first place. As the CBC Marketplace video showed, there was no mechanisms for reporting no-shows, so there's no reason for them to guarantee care to your house. Another advantage to managing your own care is that you don't have to deal with staff agency turnover. When I was with the agency for my PSW and attendant care, they would switch my staff every other month, and you have no idea of people coming until they start training at your house. These agencies would hire anyone with a pulse, and you are not guaranteed to have the most professional people working for you. When I had agency nursing, I would lock my wallet due to the high level of turnover and the random people that was sent to my house every other month. Most importantly, you get autonomy over your own care. I personally use direct funding for my attendant care and the family managed care for overnight nursing. Even though it's a lot of work, it provides me the ability to live independently and pursue education and employment. When you manage your own staff, you get to decide who you work with because you are the one that do interviews, get references, and truly trust the person you're working with. I've gotten so close with many of my previous attendant and nurses that I've gone to their weddings and their baby showers. Providing care is the most important and intimate thing you can do because you're looking after somebody who's vulnerable. And having someone look after you or a loved one that you trust not only improves your physical health, but also your mental health. Thank you so much for watching. And if you have any questions, ask them in the comments. If you enjoyed this video, please consider giving it a like, subscribing to my channel, and turning on notifications. Tune in next week where we will discuss other resources for adults with disabilities.